The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and welcome to the lovely Health and Fitness Show. I'm your host Fahad Matin. And I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. We have all been enjoying this nice and positive hot day. Yes, indeed. A very nice and positive hot day. And we do not have those days quite enough in our lives, especially in this country. Yes, indeed. It is the hottest day of the year so far. And I must say it's even hotter than places like some places in Pakistan. So I'm a bit kind of extremely excited. And I pray that you all have a nice and positive week so far and looking forward for a nice and chillaxing weekend. Although I heard that it will be slightly rainy weekend. But hey ho, it is a holiday week for kiddies. So if you not have already made plans to go out somewhere, enjoy the time, whatever time you have. This program is broadcasting live today from the studios of Inspire FM. Today, on 25th of July 2019 at 6 p.m. and casting its positive vibes to all our lovely people in Luton. And definitely the surrounding areas of Luton like Dunstable, Harpenden and Bedford. And going sometimes all the way to Milton Keynes. Our positive airways reaching to all listeners who are listening us via the Inspire FM web app or mobile app or website or viewing us via Facebook page. So, hey ho. And if you want to view us on the Facebook page, you can always go to your Facebook page and type Inspire FM on the search link, and you can see us live by clicking us live link. If you're listening to this show on Sunday or any other Thursday, other than the 25th of July 2019, that means it is repeat. But hey ho, today is not. We cover different health-related topics, and we definitely with every week. And we sometimes we cover different health topics, but some topics are really, really close to our hearts. Like as it is holiday week, children are with you, and they are enjoying this lovely weather. And definitely, sometimes children are in our life, being parents or grandparents or even uncle aunties. They hold a very strong place in our lives, and their well-being comes upmost first for us in some days or another, and definitely in the days or in the times when they're not well, we normally get worried about them quite often. So we normally do certain things. We look after them. We take them to the hospital or the GP or call people. And definitely sometimes we do need to seek help and advice from some health professionals. So today our show is complete on those topics and on those lines. So you may have get that. Just so without further ado, let me bring our topic for today. So topic for today is Children's Rapid Response Team. Yes, indeed. You have heard me correctly. Today we will be talking about the Children's Rapid Response Team, and definitely it is something which you like to know, because one thing I like to know is why do we need this team? But definitely it is something which I will not answer, because I have two lovely guests with me today who will be sharing their knowledge and experience in this field, and they are quite professionals. So let me introduce them. Guests who are joining me today is Gary and Laura from Children's Rapid Response Team. So good evening, guys.
Hello.
Hello.
How are you?
Very well, good. Thank you.
Now, before I start the show, I normally ask my guest to give a little bit of introduction about themselves, as it's a very heated day, but luckily we have sitting in a slightly cooler room, isn't it?
Yeah. Thank goodness.
But did you guys completely hydrated yourself today?
Yes.
Absolutely, yes.
Very important.
Good. Now, let's start by a quick introduction. Let's start with you, Gary.
Okay. So, hello everyone. As my name is Gary, I completed my children's nurse training at the University of Hertfordshire, and then went to work in a district general hospital on the children's ward. I then realised that I really liked A&E and the acute illness that children face. So I then spent about 10 years working in children's A&E, reaching senior charge nurse level.
Mm-hmm.
I decided that wasn't enough, so I then went on to complete my emergency nurse practitioner training, which really led me into the job that I'm in now as a rapid response nurse practitioner. Still hungry to learn more. About 2 years ago, I did my teacher training, so I'm also a registered teacher with the Nursing and Midwifery Council, and currently blend my clinical role with a lecturing role at the University of Hertfordshire. Mm-hmm. This really allows me to share my clinical knowledge with student nurses that are going to be making up the next children's nursing workforce. I have nearly finished my Master's in Medical Education, which I think is hugely valuable in both my nursing and education role.
Wow, that's a really interesting profile, I must say. You are an educator as well, and so you are a mentor to many other nurses. And plus, your interest in looking after kids. It's really cool.
Thank you.
You love kids.
Yes, I have two of my own, so they taught me a lot about nursing as well, I think.
Indeed, and I absolutely understand. Because I have two of my own, and then my niece, nephews, and so forth.
Yeah.
So I absolutely understand your angle.
Keeps you busy.
Exactly. Laura.
Hi, my name is Laura, and I also work in the Children's Rapid Response Team with Gary. I completed my nurse training in 2000, and I did my training in Dundee University in Scotland. I then consolidated my training there for 2 years, working in a district general hospital and a paediatric unit. I then moved down to Luton and worked in the local district general hospital, where I was there for 12 years. Gained lots of experience in different areas of children's nursing, working in the children's assessment unit, working in the high dependency unit. I did some courses in caring for children with cancers, and then got the bug, like Gary, for acute sort of angle of children's nursing, so went on to do my advanced paediatric life support, and enjoyed that so much that I decided to become an instructor, and did teaching with candidates all over Scotland and England, as far as Stornoway on one trip that I did, which was interesting. I then moved into the community 4 years ago, and I've been part of the rapid response team since then. Recently completed my nurse prescribing course, and I'm finishing off my Master's also, like Gary.
Mm-hmm. Wow! I must say we have quite a bit of experience between among our two guests today. Two nurses, and they are kind of a role model for their other staff members and their other colleagues, and I really love that, and I really admire that. And sometimes these things do go a long way, because once you have that respect from your peers and your colleagues, it's always somehow what's the best word? Enjoyable. It's like satisfaction, self-satisfiable experience, and I always enjoy that. Anyhow, let's start the show, and definitely let's introduce our listeners as well. So, listeners, if you have any questions or queries regarding our show tonight, please get in touch with us. We have two nurses in the show, in the studio, who are experienced with children problems, and they know how to deal with children problems. So if you have any questions or queries regarding the children's and your any problems which you face on a daily basis as well, please give us a call on 01582 481822. I repeat, 01582 481822. Or you can send your questions via text messages or WhatsApp on 07779 481822. I repeat, 07779 481822. Or you can also send your questions via Facebook page as well. So I don't mind. I can always ask your questions on behalf of you. But yeah, definitely get in touch with us. Use the experience which we have in the studio, who are there to give you necessary support and guidance, especially at the time when you need most, especially when the kids, because there are times when our kids are not well, we go into a panic mode, and as a parents, we always know that once you are in that zone, it's not easy to shake it out. It's not easy to shake it out, because on the other side of that needness or the requirement, it's our own kids who are on the line, and sometimes we need an extra hand and support to do that. But anyhow, let's start with our show, and definitely let's find out what is Children Rapid Response Service we have. So, Laura, let's start with you. Give us a quick background of what is this team do, and what is it?
So the Children's Rapid Response Team was set up in 2013. It was started by two nurses who provided home care for children with acute medical needs. This required our team lead, Lynn Fanning, to work closely with consultants from the local hospital, developing pathways to integrate into the community care. The incentive of this was to reduce hospital admission and provide acute medical care to children in the local community closer to home. Mm-hmm. Studies have proved that children do recover more quicker when they're cared for within a known environment. Mm-hmm. So initially the service was run 5 days a week. Within a year, it was recognised that there was a real need for a service like this within Luton, and the numbers of children that they saw did make a difference to hospital admissions. Therefore, the team was expanded and two further nurses were recruited, and the services then ran for 7 days a week.
Wow, 7 days?
Yeah.
Whoa. So in terms of 7 days service, so they pretty much see every single day?
Every day.
And what hours?
And so now the hours of the service now are 7 days a week, 8 in the morning till 6 in the evening, 365 days a year. Since 2015, so we did some piloting within GP surgeries in Luton, and it was recognised that we could see more children in a shorter space of time if we ran a clinic base.
In GP surgeries?
In GP surgeries. This then led further development of the service, which now runs Monday to Friday. We run a clinic model where children come and see us in clinic, and at the weekend we do continue with the home visits at the moment. But there is vision to hopefully have a 7 day a week clinic model, so children can come and see us 7 days a week in clinic.
Wow.
So the appointments, we have children on the caseload, and then we also get direct booking appointments from 111, and they get booked into our clinic. It's been a really big achievement getting 111 set up to book children directly into us, and we are one of the first teams in the whole of England that has successfully got this kind of service up and running. And we're now hopefully in the very near future developing the service further to cover the whole of Bedfordshire and not just in Luton.
Wow. So people, our neighbour sites from Dunstable and Bedford will soon reaping the rewards as well, because I absolutely understand that if any of the kids have any acute illness or acute problems which we comes into, so what range of problems you see?
So what we want to do is make sure that we're providing the best service that's based on evidence and that's up to date. So at the moment we follow 7 sort of pathways. So that would include what we call bronchiolitis. So for babies with sort of cough and cold like symptoms. Children that have got a fever for an unknown reason. Children with asthma or wheezing episodes. We also will see a child that's had a head injury or that is suffering with diarrhea and vomiting and abdominal pain. So there's quite a lot that we cover within those pathways.
So is there any age range you start from?
So 0 to 19.
Wow, that's a big long age range. Wow, that's amazing. So it's pretty much like starting from the day one till the teenagers. That's a really long. Okay, please carry on. Sorry. We see anybody from day 1 up to 19. What we like to do is make sure that we complete a real thorough history and an examination, because that really allows us to gather information to help us work out what the diagnosis might be. We can then complete a treatment plan, and as Laura said earlier, we're all prescribers. So if you need a prescription, we're able to do it there and then and give that treatment as soon as possible. So let me come back on the pathway. So that means any child who have illness like fever in children, which is very, very common, especially in the winter days.
Absolutely.
I remember I was last year in July, last year in September, November, December time, when my mum was not very well and I was in and off hospital. So I went in December time. I went to November time, took my mum there in hospital, and I see a young couple with 3 kids sitting there, and all the kids have fever. And one thing I asked them, how long you sitting there? Because I was in and out the whole thing, and it was like more than an hour or so, and they're still sitting there. So I said, how long you sitting there? He says, well, we are here since last an hour and 30 minutes. And I said, why? He says, all our 3 kids are a bit not well, so I'm here. So I said, well, didn't you call 111? They said, what's that? So I was completely shocked and surprised. And I said, oh, okay. But anyhow, sorry, that's not me to ask that. So in terms of, so you cover fever in children's, asthma and wheezing, head injury, diarrhea and vomiting. Wow. So in case of diarrhea and vomiting, do they come or do they call, or what happened?
Yeah, so we operate a referral process, so you would have to be referred to our service. Unfortunately, at the moment, it's not a self service that we offer, so you would have to be referred in by various different pathways. But Laura might like to talk to you about.
Yeah, so the families can get referred into the rapid response team from lots of different sources. Our main referrals now do come directly from 111 and from the local hospital. So we'll get them from the A&E department, the paediatric assessment unit and the wards. So if they just to try and facilitate an early discharge, they will discharge them for us to follow up in the community. We do accept referrals from GPs who may require us to provide ongoing support until a child is well enough to be discharged. We do liaise very closely with our excellent health visiting and children's community nursing team, who also refer into our service. And really exciting, we've just recently started receiving referrals from the ambulance service, and I got my first one today.
Aha!
So that was exciting. But like Gary said, unfortunately, families are not able at this moment to directly call us and self-refer into the service. It has to be completed by a healthcare professional. So my advice is, if you're unsure of the best way to be referred, then I would give 111 a call, and they will be able to triage the call and have access to the same day directly bookable appointments with us.
So is there any categories of children you see? Urgent, late? Is there any red, amber, green kind of pathways in those pathways?
Yeah, definitely. So as Laura said, NHS 111 are really good at creating that category when you call, so they will advise you where the best place to be seen is, and that's really what we're hoping to promote today, is that you don't always have to go to hospital. You know, if your child has a temperature, diarrhea and vomiting, you don't automatically have to go to hospital. There are other places you can go. Once we get to see the children, we will then complete our assessment and provide that red, amber and green category as well. And it's just a way of us deciding really how unwell your child is. Sometimes, and it's not a lot of children that we see, but if we do highlight concerning features of illness and we put you in the red category, then we might need to contact the hospital or the emergency services, because you might need to have further care in a hospital. So we try our very best to keep you at home if we can, but sometimes it's not always possible.
And you said you see patients, kiddies, in the GP surgeries, which is very, very good. And is it every single GP surgeries you see, or you do some clinics in certain GP surgeries? So
the clinics aren't held in the surgeries anymore, because exactly for that reason, because we wanted to open it up to all of the GPs in Luton. Okay, so what we do is we hold our own clinic separate to your own GP, but as long as you have a GP in Luton, you can be referred to our clinic and we will see you there.
And how long is the referral process last? Is it quickly?
Oh yeah, so you can get a same day appointment. If we feel that your child needs ongoing support, we can keep you on our caseload and provide 2-3 days more support until the symptoms are getting better and you're managing well at home without our help.
Wow. Now, these kind of things do really help a lot, because our kiddies in our day-to-day life, they see, we do see things, and we get worried about their health quite often. So have you come across any specific cases in your life, in your present scenarios, where you have seen children who are a bit kind of unwell, and the parents are getting general public who've been referred to you directly?
Yeah, I mean, we see lots of children over the course of a week, all with very similar symptoms, and you know, we understand that it can be very anxiety provoking for you as a parent, and you just want to know what's wrong with your child, and we are there to do that and to assess and make that plan of care for you. Typically, I think we see children with temperatures that might be because of a sore throat, ear infection, chest infection, or just a sort of viral cough and cold like symptom. But we are happy to see any child that we can if we feel that we're able to help keep them out of hospital.
Laura, you said you have got a referral from an ambulance today.
Yeah.
What was that about, without discussing the patient or their clinical needs?
So it was a patient who had a fever, funnily enough, just what we've been discussing, for 2 days. So just requires now our ongoing support. Parents were keen to go to hospital, but the paramedic was able to, you know, offer our service as a support. So we're on the end of the phone. The parents can phone our mobile number at any time between 8 and 6. So it just offers that ongoing support. No question from parents is a silly question, because like Gary said, it is quite nerve-wracking, and you worry about your kids.
Exactly, and there are times when being a parent, you just literally, when you see your child crying in pain for X, Y, and Z reason, at least I feel extremely nervous, like
helpless.
Helpless, and sometimes your mind stops working, and your basic instincts say one thing and you're doing one thing, and although after trainings you still
I think in my experience, sometimes parents just need somebody to say, you're doing fine, everything you're doing is right, and you've got to kind of just ride with it sometimes. Sometimes illnesses take their time. Sometimes they can be unwell for a few days, but as parents, we want to fix them instantly, don't we?
Exactly, indeed. So, in terms of your team, as you have told us about yourself and your qualification, how big is your team?
So at the moment, there's 5 members of the rapid response nursing team in Luton. We're all we're all senior children's nurses with over 15 years' experience each in the NHS. We've all trained, like we said, as nurse practitioners. And it's required us to do extra training on top of our nursing training that we completed many years ago. This allows us to work at this more advanced level.
Okay. Wow. And I must say, I do like to know more about it, but unfortunately, the time has passed really, really quickly. Unfortunately, we are going for a commercial break very shortly, in a few seconds' time. But when we come back, we'd like to know a bit more about the team and the makeup, and especially what else you can do and you can't do. Because there are times when something is presented in front of you and you says, hang on a second, and that is a bit kind of out of our reach, and we need some hospital intervention or some other intervention or GP lines. But anyhow, we will definitely come back on that. Don't go anywhere. We will be back after these very short messages.
Assalamu alaikum, this is Atif Nawaz. Listen to Inspire FM shows in your time by heading over to inspirefm.org or listen on Apple Podcasts or Spotify.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. I'm Fahad Matan, your host for this evening, and today we are talking about a rapid response team with our lovely 2 nurses from the rapid response team. We have Gary and Laura with us, who are talking about the problems which they see on a daily basis with children's, and what is the rapid response teams do on a day-to-day basis. And definitely kids in our life is most important element in most of those people who have kids or auntie, uncles, grandparents. And definitely we do want to look after them in the best way, shape or form. This program broadcasting live today on 25th of July 2019, and we are live from the studios of Inspire FM today for our lovely people in Luton, all the surrounding areas of Luton like Dunstable, Harpeth and Bedford, and reaching to our listeners via our Facebook page, our web app and our mobile apps. When I said ours, that means Inspire FM's. Good evening and welcome back. Before I went on break, I was asked, posed a question to Laura, but before I ask again what I was asking, let me ask them to say hello guys.
Hello.
How is so far going on?
Yeah, so good.
So far, so good.
Perfect. Right, so apologies. You were so nicely explaining me about your team and how your team made off and what qualifications they have, and I have to cut you off because we were right out of time. So, Laura, if I ask you to continue from where you left off, please.
Yes, so we're all senior children's nurses with over 15 years' experience each in the NHS caring for sick children. as a team, we are all either qualified at master's level or we are working towards our master's level in advanced clinical practice. And with the continued development of our service, we're also now recruiting. Anybody wants a job, have a look. We are recruiting to the team to
No problem.
enable us, like I say, to expand the service into the whole of Bedfordshire.
Okay, wow. And then I must say, at this time, I do like to involve our listeners as well. So, listeners, if you have any questions or queries regarding our show tonight, please give us a call on 01582 481822. I repeat, 01582 481822. You can send your questions or via text messages or WhatsApp on 07779 481822. I repeat, 07779 481822. Or you can send your questions via our Facebook page. And on that note, I must say I have a question on the Facebook page. It says, it says, hi, I want to ask, my feet skin's coming out for last couple of months. Can you please advise me something that can help me?
Okay, so obviously the best thing to do would be to get it looked at. Just from listening to that, it might be a simple case of something like an athlete's foot, which is a bit of a fungal infection. If you pop down to your pharmacy, they would be able to have a look at it and advise you on any sort of creams or possible treatments that you might need. But definitely get it looked at so that we can give you a proper diagnosis and help sort it out for you.
And I think also keep your feet clean and dry, and use cotton socks rather than nylon, which reduce sweating in your feet.
So what's the difference between nylon and cotton socks?
Cotton is breathable. Nylon is not.
Okay, sorry. I know it's a very awkward question to ask, but anyhow. The reason I do is that I normally wear nylon socks, so I was saying, okay. Yeah. Okay, I did not know that. Yeah. Thank you so much for answering this, and thank you so much for asking this question, because sometimes there are things which most of us do not know on a one-day basis, and it's good to ask those questions. So hey guys, listeners, if you have any questions or queries regarding our show tonight, we have two experienced nurses with us in the studios, children nurses especially. So if you have any problems with your kids, or if you have seen any kid problems, please do give us a call, or send your questions by text messages, WhatsApp, or on Facebook, and ask us. We have expertise in the house, and we will definitely share with them. Somebody just say hello to Laura. Okay. Right. Okay. So, in terms of the kiddies, you just explained me about the what your team is made of. Now, in terms of where you're based, so if somebody been referred, where they normally refer to, or where are you based?
Yeah. Very good question.
And the opening times and the closing times. You told me that your service is 7 days a week, from 8 to 6.
365 days a year.
Exactly. And sometimes parents, working parents especially, they find it hard to make it in the week, and they love to be in the weekend kind of thing, want to be seen. So tell us a bit more about this, and tell us what the timings of and so forth, and where you're based.
Yeah. Well, so at the moment,
let's start with Laura. Why?
Sorry.
Let's give a chance to Laura as well. Come on, Laura.
So there's always two nurses on duty each day, except for the weekend and bank holidays when there is just one nurse on duty.
Don't tell me that duty nurses are with me today. Yes. Both of you?
Yes. I was on duty today. So there's always two of us on duty. One of us is based in the office, carrying out the phone assessments for the children on our caseload, and the other nurse is based in clinic, and our clinic is based in Vestry Close, just off of Dalla Road in Luton, and like we said, we work 7 days a week, 8 in the morning till 6 at night, in the clinic, we do have set appointment times, which aids in reducing waiting time experienced by families. So, you'll call up, you get an appointment, you turn up at your appointment time, and you're seen within a few minutes of that time, unless there is, of course, any unforeseen circumstances, like we ended up with a really sick child that we were waiting on emergency services or something like that. But generally, the clinic runs really, really well.
Mm-hmm. Mm-hmm. So do you see any unusual cases as well?
Yeah, I guess that we don't know what's coming. So we will get a short piece of information from NHS 111 that might just say, a history of a temperature or something like that. So it's always a bit of a surprise when children come to us, because we might not know what the problem is until we've completed that thorough examination and history taking.
Mm-hmm.
So that generally it is a minor sort of illness presentation, so we typically will see children with cough, cold, fever, runny nose, that sort of thing.
All of the things in the pathways.
Yes.
Basically, it's sort of common minor childhood illness.
Okay. So, in terms of general public who want to get referred, can you please? I know you have explained me in the first part of the show, in the beginning of the show, because I was very intrigued about the whole thing. So, if families want to be referred, what's the best appropriate method? Do they go to their GPs or do they call 111? And can they call 111 during the hours of opening, like between between 8 and 6, or do they have to call? And if they call afterwards, what they do? I know it's so many questions. Sorry, I'm getting very giddy.
So at the moment, the clinic appointment system is only Monday to Friday.
Mm-hmm.
Okay, so during that period of time, the best thing to do is call NHS 111, and they can get you an appointment in our clinic to be seen that same day. The appointment, as Laura said, are timed, so you can call within the hours of 8 till 6, but our last clinic appointment is at 4 o'clock. So get in there early. If you've got any worries about your child, early on in the morning, ring NHS 111, because that will really maximise your chance of getting an appointment with us.
Mm-hmm.
After those hours, the experienced call handlers will triage your call and then advise you on the best place to be seen if we can't see you, if we don't have an appointment free.
Okay, so in terms of if they call and see and they get an appointment, like for example, if I call for my child around 12 o'clock to 111, for fever, let's say, so how does it work?
So the call handler will ask you lots of questions about your child, and just to kind of work out what might be going on, and then refer you to the most appropriate place. So hopefully that will be us in the Children's Rapid Response team. If that's the case, they will tell you the appointment time that they've booked you in for. Okay, so you won't hear from the Children's Rapid Response team. We will just be expecting you at the time that you've been booked in.
Mm-hmm.
Once you know that time, head down to Vestry Close, as Laura said, and we will see you as close as possible to that appointment time to save you having to wait around, and complete that thorough assessment quickly and get you on your way again with some treatment.
And the 111 call handlers, they go through the triage process, and that tells them whether a child needs to be seen within a 2 hour, 6 hour or 12 hour window. So if the parents did call in the middle of the night, for example, and the call handler triaged them as a 6 hour, and that happened to be 9:30 or whatever in the morning, they would just book them automatically into that slot. So it's not to deter away from calling during the night, because there is still the ability to book you into the clinic that day.
Next day, in the morning.
In the morning, yeah.
Wow, that is really nice, because it saves quite a lot of time and hassle to go to A&E.
Yeah, well, it saves the 8:30 GP repeat redial until you get through to the GP surgery.
Indeed.
111 will have done that.
Indeed.
Done that part for you.
Indeed, and sometimes we, as I said earlier in the beginning of the show, that when I asked those parents why didn't they call 111, and they said, well, what's 111? So I was surprised. I was literally surprised that there are still people who do not know the service of 111 which is there. So is it how did parents react when they see you in vestry clothes? What was their reaction after the children's getting treated?
We've had really positive feedback. I think they appreciate the fact that we're specialist children's nurses, nurse practitioners. The feedback has been so positive in terms of the fact that we listen, we complete that thorough assessment, and that we're able to give really good advice to allow you to care for your child at home. The advice that we give is followed up with advice leaflets, and it really signposts that red, amber, green kind of categories that we talked about earlier, so that at home you can also monitor your child and work out whether or not things are getting worse, and then what you need to do if things are getting worse. So the feedback has been really, really positive.
We've actually had families now phoning 111 and saying, can you please just book me into the Children's Rapid Response Service? So that's been really positive.
So I know this is for acute symptoms, but do parents who have kids with long-term conditions like asthma or diabetes or any other illnesses, kidney disease and so forth, do they come through you as well?
Children with asthma in the community who are we have a community asthma nurse specialist as well who will care for children with asthma for sort of their ongoing treatment. If they have an acute exacerbation of asthma, for example, then they can and the community nurses do refer into us, and we will carry on the acute episode of care and then refer back to the asthma nurse for ongoing.
Yeah, because in the beginning you said the symptoms which you see is bronchitis and asthma wheezing. So I wanted to ask you then and there, but I said, okay, let me ask you a bit later on that it is sometimes, because this is one of the most reason parents end up in A&E, because the kids are not have that episode and they were not sure whether to do or not to do, and they call 111 and they end up there. So yeah. So and definitely you cover most of the things, but definitely there are things which you do not cover. So what are the things which you do not cover? I mean, the team do not cover.
So really, if you think that your child is having a sort of medical or surgical emergency, or have had a fall and you think they might have broken their arm, or you think they might need an X-ray, we don't have those facilities at the clinic, so that wouldn't be something that we would see as a rapid response nurse. It is mainly the sort of acute medical minor childhood illnesses that we will cover.
So if I ask you to give me an example, because one of those things which you said is the head injury. So if somebody says, oh, my child just fall and he had cut,
Yes.
So they refer to you. What will happen then?
So at the moment, we wouldn't be able to sort of glue the cut back together. So if they did come to us and we were worried that there was a wound that needed further assessment, then we would unfortunately send you into A&E at that point, just because we don't have the facilities to be able to do the sort of wound management. We could look after the head injury, that wouldn't be a problem. So minor head injury without any cut, then please do come to us. But if you have a cut, we don't have the facilities to look at that yet.
Okay, so if I ask you to give me a couple of examples that where parents should understand that, instead of calling 111, they should take their child to ED. Give us an example or scenario where it will be better.
So an example of that would be if you're went to your child and they were unresponsive, or if they had a high fever your child was just not themselves, just that generally behaving abnormally, then I would certainly be taking them straight to A&E. I think as well, rashes is quite a big thing in children, and it's when to be worried and when not to be. And we always advocate the doing the tumbler test, where we roll a glass over a rash, and if it disappears, then it's less worrying, and if it doesn't disappear, then it is a trip straight to A&E. Again, if your child has breathing problems, they're using their tummy lots to breathe, groaning when they're breathing, or any discoloration, so cyanosis, blueness round the mouth or anything like that, that would be a reason to call an ambulance and go straight to A&E.
Mm-hmm. Mm-hmm. That is very interesting, because there are times when being a parent, you see that, yes, you come into a doubt whether to do or not to do. And it's really tough in those timings, especially in those timings, because it's not easy to make those clinical decisions, and there are times when we say. So in your personal cases, can you give me an example of when you would be appropriate to see a child in a service? So when I said I've asked you for examples of patients who's not fit to be seen by you guys. So I'm now asking example which a child fit to be perfectly seen by your team. And if a parent's calling 111, they can request, can you please book me with the Children's Rapid Response Team.
Mm-hmm.
So can you give me a couple of examples on that?
Yeah, so quite commonly children get ear infections, and they might just develop a temperature and sort of be a bit off of their normal self with a bit of reduced eating or drinking. It would be very reasonable to see us in the Rapid Response Clinic rather than go to A&E for something like that. Mm-hmm. We're very happy to see children that have got coughs, colds, sore throats, or anything that doesn't present with a sort of medical emergency.
Mm-hmm. Mm-hmm. Wow. Okay. And in terms of you explained that there are parents who are extremely happy with your services. Are there grumpy parents as well who are not happy with the services? I know it's not a nice thing to ask, but do you see any unsatisfied customers as well?
Of course, you always have some issues, but I think the issue that we have been presented with was not a huge issue, in that the parent was a bit unhappy that they weren't told that they had to pay for parking, which they needed £1 for the car parking machine. In the clinic that we ran. So that's probably the most negative comment that we've had.
Sorry, I was a bit surprised because Vestry Close was free to park.
Vestry Close. So when we were based in Medici, it's a pay and display car park.
Yes.
But at Vestry Close, it is free parking. So that problem no longer exists.
Yes, indeed, because I have a fair share of going there quite often for my clinical meetings as well. Yeah. Wow. And on that note, wow, the time has passed really quickly. We are coming very close to our end, towards the end of the show. I do like you to, for listeners, if you have any questions or queries still, please do get in touch with us. We still have a couple of minutes left. If you have any questions or queries, you can send your questions via text messages or WhatsApp on 07779 481822, or you can you can call us in the studio by calling us 01582 481822, or use the Facebook page live to post your questions. So it's time for positive message from both of you. So let's start with you, Laura, because you have talked really less during the show.
Sorry. I am gobsmacked. So my one bit of advice: if you need any medical advice or support, call 111. That's what I feel is the most important message.
And why is that?
Because you can have your unwell children cared for by a team of professional children's nurses.
Because one of the things which most of the people do respond when they call 111 is that I'm just playing devil's advocate, is that they ask too many questions. They just literally keep asking all those questions, and some of those questions are very annoying and unnecessary. And why they do that? Why they do that?
Because they're triaging and assessing how urgently children or patients need to be seen.
Definitely, because yes, certain times when you are seeing patients, there are multiple reasons for a common fever as well. Wow, yes, good. Gary?
Yeah, so I think I just want to echo really what Laura said, and just stop and think. Do you really need to go to A&E for this problem? And I know we keep saying NHS 111, but they are really good at deciding where you need to go, where you need to be seen. And what we want to do is to really look after your children in the most suitable environment. So if in doubt, just give 111 a shout.
Wow, I must say that is quite positive, and then there are times when we do want to get our child looked after properly, and it's not easy. It's not easy, especially when we need some help and advice and guidance. Sometimes all you need to do is just pick up a phone and call 111,
Definitely.
which is free service, isn't it?
Definitely.
Okay, in terms of kids itself, I know it's something which I wanted to ask you. If a child come to you with a bronchitis, how do you know that it is bronchitis and not asthma? Because there are times when they mimic quite often. Sorry, I know I'm putting you on the spot for that.
So bronchiolitis affects younger children. Any child sort of over the age of 2 would, up to the age of 5, would be diagnosed as a viral-induced wheeze rather than an asthma. Asthma comes with a long history of breathing difficulties from a young age, with night coughing, and usually they have more of an atopic allergic background to other things as well, so hay fever, a bit of eczema, things like that. And bronchiolitis is diagnosed on assessment and examination, taken, like we said earlier, a thorough history from the parents and listening to the chest. The chest sounds in bronchiolitis are different to those of asthma.
Okay, cool. Thank you so much for coming today, and thank you so much for enlightening us, and thank you so much for putting you on the spot and you give me a right answer. These are things which happens quite often, and this is a live show, so it happens quite often. But yeah, thank you so much for coming on our show tonight and sharing your lovely knowledge and experience with us.
Thank you for having us.
Thank you for having us.
And thank you so much for all us listeners as well who joined us today and viewed us on Facebook live page. If you still have some questions or queries regarding our topic tonight, do send us an email or send your messages to us. We will try to address it later on the show. And definitely these are the guests who came today, but they're not just here for once. They will come again in future, right, guys?
Yes.
And we will welcome you again and the next time as well. So this is all the time we have, folks. We will see each other again next week, same time, same place. Until next time, please remember us in your duas and stay well hydrated. Till next time, Assalamu alaikum.
Thank you for listening to our podcast. Why not tune in to our live stream at inspirefm.org and follow and subscribe to our social media platforms at Inspire FM Luton.